Hi everyone, this is Ms. Leelu with Dr. Beth. She's 14 and a half years old, and today we're going to watch her get some acupuncture in Cairo.
All right, hi everybody. Leelu here is the best. She comes in because she has some arthritis in this area of her body back here, kind of in her lumbosacral area. And she is an incredibly active dog, so she does a lot of things that keep her nice and strong, but also because she is compensating a bit, can make her prone to injury. She also struggles with some little challenges with her kidneys and her liver, and so we're going to nourish those things as well. And she's a very happy camper. She's one of my favorite stories of having to move to curbside service. She seems to like to come in and hang with me and Sam, which makes us happy. All right, so first I'm going to give her the once over, looking at her from the Western medicine point of view, but also the Eastern medicine point of view. So I'm looking at her tongue. It's kind of thick. It's kind of damp looking. Damp being just kind of accumulating some extra fluids in there. And this weather has been hard on so many dogs. That we find that a lot of dogs who struggle with stiffness in the damp weather, in the hot weather, can be exacerbated. So we're going to look in her eyes and her ears and feel her body all around. She's really good for everything. She is well trained by her mama, who knows what she's doing. Right, Miss Leela? Alright. So we always like to try to let our patients explore when they're here, because especially during these times, it's a nice part of their day in terms of enrichment and brain stimulation. And because I feel like they're getting touched less by people in their neighborhoods, on the streets, all that stuff, I think it's extra good. Sweetheart. Just doing some flexion and extension of her body, noticing which legs, a little more reluctant on that side to extend her elbow, noticing which leg she's bearing more weight on, that type of thing, feeling for lumps and bumps, which she has a couple. Feel her belly, and I'm going to feel her pulse and see if I can feel that dampness in her pulse as well. They've done some cool studies when it comes to tongue and pulse. It sounds like crazy, crafty witch talk, but they've actually done a bunch of studies that have shown that the color and the thickness and the kind of general characteristics of the tongue can actually match to what's going on in the physiologically in the body, so it's pretty cool stuff. That Chinese medicine had a heads up on. You can see she's a little bit more reluctant to lift that leg up. And I'm just kind of feeling her muscles back here too. As a massage therapist, I think Sam is better trained at feeling muscles for spasm, things like that. I'm feeling mostly for areas of tenderness, but also symmetry in her body to see if I can get any ideas of where she compensates.
And she thinks Beth is going for the liver treats.
Usually Leelu reminds me by gazing up at them now and then. She's like, maybe Sam will give them to me. I feel like we make a lot of friends through our liver treats, Sam. Another thing that we've enjoyed about our move to the curbside service, we have to find some good things about it. But one thing is that we've been in this room of ours, which is at the front of our building and with lots of windows. So I was just saying our last patient acts like, I'm going to adjust right now, that it's like watching TV because we're right on Mass Ave. We have lots of passersby, daycare kids, families, dogs, people.
It's great distraction.
That's right. I think it was Susie Q who was the first one that we used it for her adjustment. She used to sit up on the hassock.
I don't know if everyone can see Leelu's face right now, but she looks very happy.
A lot of animals, I feel like, definitely.
Of course, I tried to show you.
A lot of animals, it definitely is soothing to have an adjustment of the neck for them. That's a good one. And just even, that's some tender areas. Putting extra, that's sore. You could just give that a rub for a second, huh?
And that's how subtle the signals from the animals are, I would say, when they're tender or trying to communicate with us. It's very subtle.
We just have to listen, right?
Mm-hmm. What is that quote that I love? It's like animals talk, we just have to know how to listen.
Mm-hmm. Very true.
I know that's not the exact one, but
But that's the gist of it.
Yeah.
I think the other thing too is that, like, I think Sam and I both watch their eyes a lot because sometimes it's just a shift of the eyes or a shift away from looking at us. It's going to direct how we're going to do the next part of the treatment. When we have all our furniture in here, we actually have a cabinet that has some mirrors, and that can be really surprisingly helpful because I can see their faces, but I don't have to be in their face because that can certainly be intimidating if you're not Leelu who likes a nice hug. My buddy here. I know. Leelu is very motivated, and so sometimes she doesn't show us, I feel, where she's stiff because she wants to be on to the next thing. So she's a good example of having to really carefully look and listen. Yeah, but I think she's got some tenderness kind of in her low neck, and that shoulder's a little tight. So in chiropractic, when I talk about something being restricted, it means that, and that area was restricted, as is this area right here on her thoracic spine. It means that it doesn't have the normal flow that I'm looking for because it probably has some adhesions that are built up. So that's what we're trying to break down with the adjustment. Oh, Sam, that's our new floors.
Oh.
Because I sleep and dream of traction options for my patients, we're trying to get a new floor in here to make things. Leelu, you might have to try that out for us. Make things even easier for them. And make sure we can do, that was a good one.
That was a good one.
So no loud cracking. Nothing too forceful, just...
And that was just a subtle release of her face. But that means that Dr. Beth is doing all the right stuff.
And Leelu is really great about tolerating everything. Some animals need to have more breaks as they move around the room a little bit more, but she's kind of a pro, aren't you? Do you want to take a little shake or you want to do some needles? She's like, I want to check out those new floors. All right. Oh, it almost looks like I was towards...
I don't know if you guys can see, but the treats are right up there. That's what she keeps gazing at.
She's like, those things are the best. Liver is an excellent treat for dogs. And so it is medicinally valuable. It's not just solely bribed for us. All right.
And Beth, can you tell us why you usually start with GV20, the point on top of the head?
GV20, this one right here. If you feel your dog or cat's head, there's a little bird. There's a little point to their head, and if you head straight towards their nose from that little point, you fall into a very faint divot. Well, some dogs it's faint, some it's big. And in there is a point that is on the governing vessel, which is this meridian that comes all the way down the back and to their bum. And it is a nice relaxing point for animals. You need to walk around a little bit. And so usually we start with that, unless it's an animal that is really shy about their head, in which case we might start with a point back here that has similar properties called ba wei. I'm going to use that for her as well, but more for the purposes of her arthritis back here. Leelu is happy to be here and not super nervous, so she doesn't need it as much for that reason, but there are some animals that as soon as you put that acupuncture needle in, they really settle down quite a bit. And some animals hate its guts and want to shake it out, and that's okay too. We don't know until we try. And so we're going to do another point on her governing vessel, which is a really good point for harnessing energy, so she can play with her friends at home, including her new brother. Pretty exciting. You get to raise him in your own image, I hope. See the best.
Sorry guys, apparently Leelu wants a close-up right now.
And we're doing some points for her bones. Also some points. These might be a little bit more tender because she's carrying a lot of tension behind her scapula. You can see her thinking about that. Right? You're the best. You're the best. And of course, if there was anything that was too tender and was really bothering her, we would just take it right out. And even if we took it right out, that side is more sore. Even if we took that needle right out, it would be doing a job. And that job would be, it already went in and rustled around the cells underneath the skin and caused some chemical changes to occur, sending some messages about reducing inflammation and reducing pain. And so even if the needle is not staying in, those changes still are going to happen. This is her liver point, so we'll see how that feels. In veterinary medicine, I would say there's a mix of practitioners who just place needles versus place needles and kind of twist them around or further stimulate them. I tend to put them in and leave them alone, but sometimes if I feel like that point needs a little extra, I will do a little twisting or a little extra stimulation. Gosh, she looks so...
I know, I'm just gonna film her face for this one just to show people that it's not too uncomfortable.
No. And we're back here in her lumbar spine, coming around her vertebral bodies, and this is the area that can be a little bit uncomfortable on some. And you can see in her face that she knows we're working on things. But I think by now she trusts us that you'll feel a little bit better after. That's what I would like to think.
Yes.
That's what I would like to think. You're the best. I know, we'll get there. We'll get there. And because of some of that sensitivity around that shoulder, I'm going to put a couple points there, if she'll tolerate it. So the dog has a shoulder blade that kind of wraps up here, and then so her shoulder is actually right here, comes down into her elbow. So interestingly, when I was doing my exam, it seemed like it was her left elbow that was a little tender, but I bet it's coming from the shoulder. It's very hard to extend one without affecting the other. Same with flexion. Would you agree with that?
I would agree.
And Leelu has some really awesome ways of playing, so I'm also willing to bet that she might have come down a little bit hard once with that. I'm not incredibly worried because I've seen this in her before, but I am going to treat it and make sure that I don't overlook it. I'm sorry, I was kind of on top of you for the first second. Alright, and then to balance things out, I'm going to put some things in her hind legs. Probably stomach 36 if she tolerates that okay, which is also known as the 3 mile point, which is named that because it gives you energy, and it was said that if you needled stomach 36, that the person could go on for 3 more miles. I love that.
Good job, Leelu.
And that's it. We're going to do a little bit of cold laser, but we're going to let her be herself and not be on camera for the rest of this.
Yes.
And if anyone has any questions, feel free to email us or put some questions in the notes underneath. Next week we're going to talk, I think I'm going to talk about the Assisi loop, which is an electromagnetic device that we use a lot here. And we're actually going to get a bed on loaner to see if that helps our patients. So I will give everyone an update on that from the comfort of my home next Monday, I think at 11. Okay?
Perfect.
Thanks, everybody. Have a great day. Stay cool.